As a complimentary approach to help them to thank you for welcome, sir.
Small. Yeah. Yeah, good morning.
Good morning, sir.
You can hear me. Yes. So I'm saying there's no need to use a microphone. I can talk to 500 capacity audience, and you will still hear. I'm a teacher, also as a teacher. One of the attributes of a good teacher is that you are not just an effective communicator, but you must be heard, and then you should be able to talk to people, just like a preacher or a pastor. You should be able to do that. But we have a very small hall, and we are not too many here. Well, it's always a privilege to be here and to do this. I think I've done it several times. I've done it in Kenya, in your head office, with your state coordinator, who happens to be my former student, the university. And I did it also for Port Harcourt. And also about 2 times online. And also, this is the second time of doing this again. So, it's the same topic, but I try as much as possible to revise it with the contemporary issues and information. And then also, since we always have a different audience all the time, I think that the last time is only one person that was here, and I think she's still here today, except the organizer. So we are relatively new. I saw quite a number of them, chance and took a picture. And just like the moderator said, everybody is looking beautiful. And I was not too surprised when one person introduced herself as a beauty. And she so maybe the parents have the issue when she was born knew that she was going to actually be beautiful. Or maybe she looked beautiful immediately. She came out and the parents had no choice other than to just say, your name shall be beautiful. And name is very, very significant and important. Name follows you. Whatever they call you from time to time, you become that thing ultimately. And it's important for people to always be careful of the way you answer. And also, when you answer success, it's likely that success will follow. That is very, very significant. So, and Mrs. Eberity is here. I think I met the husband online. Then this is the second time of the same time I've visited one of the facilitators. And Dr. Clement has always facilitated this for the power team, and is well appreciated. The value of a nutritional therapy as a complementary approach to health care. Now, I think let's start with this slide. Now, you can see this. This is a statement by the late sage. Let food be thy medicine, hypocrites. So, since time immemorial, the people who really understood the importance of the nutritional therapy and actually envisage or hypothesize that at a particular time or point in time, what you eat will be very, very important and will play a pivotal role in your life and in the maintenance of the earth and also in the treatment of diseases. In the time past, you find out that people were using conventional medicine. Up to today, they still use conventional medicine to treat people. But this man, several years ago, knew that a time will come whereby the doctors of the future will not be prescribing conventional drugs, but will be prescribing food as medicine. So he said several years ago, let food be thy medicine. That is to say, rather than taking chloroquine or taking propanol or taking ampicillin or any antibiotic, for whatever ailment, then why don't you look at the food? But it looks somehow, so for people who don't know, how can food serve as medicine? Are you telling me that whenever I fall sick, then I should just take the food and I will be okay? And you will get to know that it is very, very important that, in actual fact, to prevent sickness, to prevent any ailment, food plays a major role. And even when you are sick, it becomes possible even for the sickness to be reversed by reason of what you call dietary lifestyle changes, and that is a very important. Most of the sicknesses that we have today actually is as a result of the dietary change. Someone was telling me a few days ago, a lady died of breast cancer in the 40s. Another person, a man died of colorectal cancer in the early 50s. Or a lady died, one of my master's students died in her early 30s of the breast cancer after giving back to a child. The lady did master's with me some few years ago, and she's just like 34 and died of the breast cancer. That is an anomaly, it's an aberration. For someone of her age to die of the breast cancer. Cancer is not a disease of the young. As a pathologist, as a scientist, as a biochemist, as a cancer biologist, I know so much about this. It is not the sickness of the young people. It's actually supposed to be the sickness of the old. And as a result of the changes in the cells, the morphology, and the aging process, your organs and your tissues are not expected to last you forever. In actual fact, nobody is expected to last forever. You are not expected to live forever. At one point or the other, you will die. But what cancer is that at a particular point, maybe when you are in your 70s, late 70s, or you are in your 80s, and the cells and the tissues begin to malfunction, and you now say that, okay, somebody is having breast cancer or having one kind of cancer at 85, or a man having a prostate cancer and cannot urinate effectively at the age of the 90. Of course, that is expected. That is expected because of the aging process. But not in your 30s, not in your early 40s, not in the 50s, even not in the 60s, because a 60-year-old person is still very young. So what we're trying to say is that people get into this situation whereby they contract sicknesses, especially terminal diseases like cancer, as a result of what? Of the dietary change. And very unfortunately, especially Nigerians, we love everything that comes from outside. We don't like whatever is indigenous. We don't like whatever is a soul or even made here. Somebody is wearing a shoe, and you say made in Aba or made in Anambra State and that kind of thing. And I always say, you are saying made in Aba. Somebody has been able to make anything. Rather than to credit them, rather than to support them and encourage them so that they can improve on what they are doing, or you want to buy Gucci, you want to buy something from Marks and Spencer, you want to go to the United States and buy stuff like that. And we have adopted the same lifestyle in terms of what we eat. Okay? And that is actually the reason why we are having the diseases and terminal illness, because of what we eat. Studies have shown that about 70% of the cancer, okay, is as a result of what? Of the diet, what you eat. The question is that what do you eat every day? Okay, you take butter, you take egg, you take all sorts of things. You take beef. When some people want to eat, you'll be surprised as if maybe 50 people want to eat that particular food. And in Nigeria, you consider that a sign of the affluence, a sign of the arrival, a sign that you are sleeping rich. Somebody put a big bowl of eba or something here, and they put a pie of the meat, assorted meat. You have a cow leg, a cow tail, you have chicken, you have all sorts of things big like this. Then it shows that you are wealthy. And when they receive your entertainment, somebody present that, it shows that you are respected. It shows that he really values you. And you too, you descend on that and you begin to eat that. Then, in not a long time to come, you develop this type of disease we are talking about. So we must really be mindful of the nutrition. We must really be mindful of what we eat. Even though we know cancer can come, for instance, as a result of a genetic makeup of gene or inheritance or what happens maybe to your parents or your ancestors and stuff like that. And also we know that environment, exposure to environmental chemicals, exposure to environmental carcinogens, exposure to air pollution, particulate, contamination, one way or the other can, cause this type of element, a cigarette, smoking, and all sorts of things may bring that to pass. But diet is very, very important. And as I'm saying, that even if you develop a diet problem, all right, and you change your diet or lifestyle to something that actually is like this, then one way or the other, you can reverse that situation. So the man said, let food be thy mercy. What type of food? Look at this. Can you see green? All right. You have a leaves here. Now, can you see this? You have what is this? Come on, let's. What is this? Huh? Something like that. Yeah. You see this? You see this? Strawberry. You see coconut. What is this? What is this? You see tomato. You see that? What is this? You see this? What is this? You see this? Yeah. Now, do you see just a one color? No. Now, sometimes because somebody presented, I ordered for food for rice, and I told them that they should get, rice, get the stew, and get some vegetables and some things there. And when the waitress said, she just brought the rice and the fish and just the stew. I said, it's not what I have. He said, well, they don't have that. And I, I said, see what I don't eat this type of thing. And I explained something to her. I said, if whatever food that you are eating and it's just one color, just know that you are not eating one. Just one color, regardless of the color, just one color, especially white color. Especially white color. Oh, you put just gas somebody, maybe eba, all right, and pepper, or rice, white rice, and it's just white. Okay, it's not good enough. What is rice? It's also carbohydrate and it's a sugar. Eventually will be converted to sugar. Indirectly, you are taking sugar. But when you eat rice and you have all these things like this on top, you understand what I'm saying? Then you are eating correctly. And that is exactly what we're talking about. A particular study, a very big cardiovascular study that goes across about 4 continents with a multi-million-dollar research grant demonstrates that people with a lower cardiovascular disorders, and people that actually that have no risk for hypertension, okay, are people who invest a lot on dark green leafy vegetables. Dark green leafy vegetables. Epidemiological studies demonstrate that those people, they develop a less of cardiovascular disorders, less of hypertension, as compared to people who do not invest in what? In dark green leafy vegetables. The people who did the study didn't understand why they had that observation. Not only in one place, in several communities, they just found out that using questionnaire and asking questions, they then found out that people who consume daily and regularly dark green leafy vegetables already not develop hypertension, coronary heart diseases, atherosclerosis, and all those things were not present, even though they did not understand. And I was present at that seminar, and I just told the presenter that you do not understand because you are a medical doctor, all right, and you are not really inside. I understand the reason why you had that observation. You can come around and let's collaborate. And that is it. And that is the truth. So it is important that people take note of what they eat, and these type of things that you see, they are very, very important, for maintenance of health. Now, in the early centuries, doctors and medical practitioners, they depended on the use of drugs for maintenance of human health. As I said before, the drugs have proved to be very useful in managing illnesses, but there are a lot of side effects when you take some drugs, which one or the other can bring about the subject is other diseases. Doctors are here, pharmacists are here. For instance, you have analgesics, you have a chemotherapeutic drugs like the cisplatin. One of my former students, also a female, who is an associate professor in the one university in the Rwanda, just came home a few days ago and told that she had to undergo some surgery and she is under chemotherapy. I said, what is the issue? And you have to take one dose, 2 doses, and that kind of thing. Okay, chemotherapeutic treatment is not it's not designed to actually take care of that cancerous cycle. There is no selection. It affects both the living cells, the normal cells, and the cancerous cells. It's not selective. It's not that when you take it, it is selective, it goes to actually kill the cancerous cell and then leave the other cell. No, as it's killing the cancerous cells, it's also killing the normal cells. So you might find out that you have like maybe tumor or cancer of of a colon or so, and you are taking chemotherapy, or you have breast cancer and you are taking chemotherapy for that particular treatment. It's going to kill the cancer cells of the breast. They are likely going to be healed, but you may have a problem with your kidney. You may have a problem with your lungs. You may have a problem with your liver, because the chemotherapy is a systemic, and is going to kill and affect normal cells that are not having issues. That is the problem. So you have several side effects of the drugs, even including malaria drugs. People don't know. It's not all the time that you fall sick, you have malaria, and the next thing is to take a camoquine or take a chloroquine or begin to take Fancida or take a artesunate. Even the artesunate drug that they are taking nowadays has a lot of issues, because the mechanism of action of artesunate and some of these drugs is via generation of a reactive oxygen species that kill the malaria parasite and kill the malaria cells and make sure that you are okay. But the reactive oxygen species generated by the anti-malaria drugs also have a way of affecting the cells. Natural fact, that is one of the reasons why they abrogated, the use of some of the anti-malaria drugs. For instance, amodiaquine was very, very effective, but because of what we call agranulocytosis and the severe hepatic disorders, they decided to actually stop the use of amodiaquin in the United Kingdom several years ago. Okay, alofantrine came on board, very effective anti-malaria drug, but because of the problem, the cardiovascular problem that alofantrine and metformin cause, they had to what? Stop the use of those drugs. And now they came up with artesunate, which is a plant-based, but several studies have also shown in terms of the mechanism it causes free radicals. That is why doctors will not tell you, maybe they don't know. When you are taking some of these drugs, the pharmacists and the doctors will tell you, for the time that you are taking this drug, don't take vitamin C. You know, they told you, don't take vitamin C. They say, don't take the fruits, don't take, juice, 5-alive, and all those. Many of them don't know this. Do they know? They don't know the reason, but they just say you should not. I was to buy a testimony with one of the pharmacists one day on the counter, and he said I should not use this one. I didn't introduce myself. So I laughed and I asked him, I said, why should I not take vitamin C? Why should I not take a fruit? And I pretend that I like taking fruits. I like taking vitamin C all the time. He said, no, if you want this drug to work, don't take vitamin C. I said, please educate me. Tell me. He couldn't give the reason. I said, please tell me. I said, you should be able to tell me, otherwise I'm not going to take. He didn't know who he was talking to. You know, some of them can be so arrogant. We call the arrogance of ignorance. Okay, there is arrogance of ignorance. Rather than he now say, look, I'm telling you if you like it, take it, want it to work. And like I said, calm down, young man. Say, do you know who you are talking to? He said, he doesn't care like that. But even we are so like this, just a simple shirt. And some of us we don't have a big stature like this. There's tendency for people not to understand and appreciate who you are, except when people listen. But when they listen and they perceive my voice, you will think twice. That is not a matter of the stature, it's a matter of the content. So,
I think that.
The content is the yes, somehow there is a people who are told there is an impasse relationship between the intelligence and the heart. You understand that? So, so I now told the young man, I said, well, let me just chat with you that I'm a scientist. I said, no, I just wanted to help you so that you can help your patient. And I said, you don't know that. Listen, when you administer drug like this, the reason is because you are saying this drug is going to kill the malaria parasite by what mechanism? Because free radicals are going to be generated from the anti-malaria drugs. And vitamin C is an antioxidant. So when you take vitamin C at the same time with the anti-malaria drug, the vitamin C will compromise the therapeutic efficacy of the drug because it's going to counteract the effect. It will not allow the free radicals to produce the effect. Therefore, you don't take vitamin C so you don't release antioxidant and let the free radicals go into the system and kill the parasites. Then when the parasites are dead after some few days, you can go back to the vitamin C. He said, wow. He said, thank you very much, sir. I said, that's okay. And I told him that I'm a professor of chemistry and consultant toxicologist. You now proceed as that's okay. Next time. That is knowledge. Knowledge does not end with the doctors or anybody. Other people also have it. That is exactly what you are saying. So you have this, there are such side effects. So now, examples of drug with side effects, as I look at an analgesic, paracetamol is one. Paracetamol, you have headache, you take paracetamol. It can cause liver and kidney damage. If you take it and overdose, chemotherapeutic drugs, cisplatin, as I've said, anti-malaria drugs, as I've said, they can cause this type of a problem. Okay, therefore, there is a need to search for alternative medicine on account of the toxicities, severe side effects, and drug costs. There is a need for alternatives. And the people prefer alternative therapies with little or no toxicity. and issues when you take them. And it's not really that expensive, also you might be able to. This is a contestable, but it's also very available and accessible to you. And also at the same time, it's very, very effective. And those are the things that the qualities that are needed for you to actually enjoy the alternative. So these are the alternatives that the dietary supplements are very, very important because many of you that you are in Lagos, in Abuja, and in our brown states, you are by virtue of the fact that you are working all the time, job, description, exigencies of the duties, you may not really have time to eat or even eat well or be able to source for it. But if you have some of them already encapsulated in form of the capsules and supplements, you can take one and take this and put to your hand and you can eat it. And that is where this supplement issue now comes up. So, but good nutrition and diet is important. Investing in the plant-based phytochemicals also very important. Now, what is a nutritional therapy? Nutritional therapy, and you can see these slides. You can see all sorts of things that are also put together. You can see this. You can see beans. You can see this. You can see spices. You can see almonds. You can see this. You can see onions. You can see green. You can see all sorts of things put together. So nutritional therapy as an holistic and back individual nutrition. You look at it in an holistic fashion, all right? And nutritional therapy is based on the idea that the health can be achieved through a holistic and back individual approach to nutrition and lifestyle. The therapist approach considers poor nutrition. Poor nutrition is a very, very bad, and they need to consider that in bringing about effective therapy. And that brings about the considerable weakness in the body's physiological foundations and structures. And that appears to be the root of many modern health problems. In order to address this, nutritional therapy focuses on honoring body's innate feedback system and incredible capacity to restore, to regenerate, to reinvigorate, and to correct itself. And this is a very important. I need to state it. Look at what it says. There is a feedback system and an innate ability of the body to actually regenerate itself and to correct itself, to abrogate the process of the sickness, the process of the disease, and revert the cells and tissue to what it used to be as a result of what? Of the corrected dietary lifestyle change. That is what is important. The dietary lifestyle change is that you are on this particular course, wrong course, like this, with what you are eating, and all of a sudden you make a U-turn. A U-turn. You are not going that direction, and you are walking in opposite direction to that wrong dietary lifestyle. And in a number of few weeks and a few months, you just discover that the cells that were deteriorating, all right, and they begin to regenerate, and you find out that you are normal again, even without taking any conventional drugs or subjecting yourself to surgery. Most of the things that you will have, either something that is a tumor, that is a bee, or whatever, and doctors say the solution is a surgery. Doctors will always tell you that the solution is a surgery. But find out that when you do this dietary lifestyle changes, that particular thing that is a bee, occupying an unnecessary space, on its own will begin to shrink and come back to the normal situation. Why? Because of the change. Just as to experience even for your weight reduction. There is nothing that is not possible. You see somebody that is so big, that is so fat, and cannot walk, cannot live, let that person, all right, bring about the dietary lifestyle changes. You find out that the person might be looking at the end of the day like an HIV patient. You begin to say, what? Are you sick? The person is not sick. The person has been able to change the dietary lifestyle and the person is healthy. That is exactly what you are talking about in respect of the things. So the nutritional therapy practitioners take a foundational, holistic approach to wellness by supporting the foundations of the health, properly prepare nutrition, nutrient-dense whole food diet, optimal digestion, blood sugar regulation, fatty acid balance, mineral status, and hydration. It is very important. Most of you that you are here, I'm sure whether you want to be enlisted in the business and you want to be doing it, you need to know this because at the end of the day, you call yourself a nutritional therapist. And when you have patients and you are even selling, this is a supplement to them, you must be able to understand some of the things that I'm teaching this afternoon in order to be able to help the patient. It's not just sufficient to say, buy this forever and just take it. You must be armed with information as a nutritional therapist and be able to actually educate that individual on the correct way of a living in order to achieve the desired effect from what you have said. And that is where knowledge is very important. So at the end of the day, you will be nutritional therapy practitioners when you are into this. But you must be able to understand about wellness, you must be able to understand the foundations of health, and then properly prepare nutrient-dense whole food in order for the supplements to work. I take most of this forever living the supplement, okay? But I don't just take them because I know how they work. They work in tandem with what? With a correct dietary lifestyle and a correct nutrition. Then you'll be able to get data that the full import of what you are getting. But if you don't do that, you might still not have the desired effect. So it is important that you have this knowledge. So it's a nutritional therapy that sit on a growing number of medical experts now have started to emphasize diet and lifestyle as the primary means to achieve it. Lifestyle changes involving regular exercise, and regular exercise involves so many things. People do not know. Exercise is not only that you are jogging, it's not only that you are running. Exercise is not only that you are jumping. A lot of the exercise are there. There is no time for me to be able to teach fully. All right, all of you that are here, you are adults, especially those of you that you are married. Regular sex is exercise.
I hear you, sir.
But people do not know. It's a good exercise for male and for female. People do not know. You see some women, they say that, this is too much, I don't want this. You are also denying yourself for certain things. You see some women who are dull, who are not sound, who are moody, who are unhappy, who vent their anger on the different people. Sometimes it's as a result of what? Of a lack of what? Of a regular exercise, self-exercise. A few months ago, I was at Ikeja, British embassy. Okay, and I wanted to, renew my visa. And of course, the place is always a crowded. And my driver who drove me had already left. Lo and behold, I carried my bag and my laptop was in the bag. So at the point of the entry, the lady that was there to scan said, you cannot go with your phone, you cannot go with your laptop. I said, how do I do it? He said, help me keep the laptop. He said, no, I cannot keep the laptop. Because she was just as if we fought before, or we met before. She was just talking. I said, what do I do? He said, no, I cannot help you if you are not ready. Go back. I said, why this? All right. So I was now going back and wanted to call my driver, to come. So sometimes I have a way of doing my thing. So because as I look at her, she was young and you shouldn't talk to a senior person. So when I said, why are you talking like this? He said, you did not even know who I am. And I don't even need to introduce myself. But looking at me and you can see that I'm older than you. You should show some respect. So why are you talking? I said, you are not more than maybe students that are taught. I said, which school did you attend? Then she said, she attended university. I said, I'm a professor from the University of Planning. She said, wow. I said, I'm a professor in College of Medicine. And that is exactly what we do. The moment I said professor in College of Medicine, now she had a problem. She then calmed down. She now said, okay, sorry, sir. Okay, sorry, sir. Laptop. She now started being nice. So I look at her, she now started being nice because she had a problem and she has seen somebody that may help her solve the problem. That's why she calmed down. So, and I gave her the chance. I was saying, sir, I have something to discuss. I know you be discussing with somebody that you are, like that. And he said, sir, you have a problem. I said, what's the problem? What was it? She said, she have not seen a period for months. She have not seen a period for months. No, and I asked her, are you pregnant? I said, no, not pregnant. That the thing comes on and off like that. And immediately I diagnosed her. There's a way of diagnosing people from the way she attended to me, as I told you, and with what she now told me, I can tell that. Then I asked her a question. When last did you ask her? He said, long ago, maybe about 2 years ago, that is your problem. He said, how? And then I explained to him, he said, that is the reason why you are heavy, you are aggressive, and you are just fighting, and you are not calm. Serotonin, endorphins, happy hormones are secreted when you have regular sex. So when you see people in offices that are venting their anger on people and shouting, go and find that something is wrong in that person. But when you see who is always smiling and happy and not dull and sound, you understand? You are very, very active. And that is the truth. I have several examples. I used to have a technologist in my lab. When you enter the lab, our facial expression will drive every visitor away. No, I'm telling you. And unfortunately, she sees directly to entrance. As soon as she's the first person you see, and you will not want to even ask after me because you say, what's wrong with this thing? Unhappy. She was with me for a long time. She wasn't married, and that was a problem. And she's some of these, maybe Catholic, brought up the people dying, people who are trained also. She was a virgin, she had not seen that, but and she had passed over 30, not married. So she's always unhappy, and aggressive. And anything like this, she will fear what we will begin to see, abusing everybody. All right? So what happened was that by the grace of God, we organized a man for her. And when she got married, after 6 months, whatever, Kate will come to office, I'll be smiling. I'll be saying, because I don't look, I say, you can change. And I said, what happened? You are so happy now. He said, I'm happy, this and that. She will not know. I'll just say inside of her. I know.
Don't get you.
So, it's a very, very good exercise for the female and also for the male. It's also very good. It also helps your prostate. Studies have shown that men should ejaculate at least 21 times in a month. You get it? Yeah, go and find out. Studies have shown. And the reason is that it's a way of more or less, purifying and also ensuring that you have a healthy prostate. It's very, very important. So it's a very good exercise. Both physical exercise and indoor exercise is also very, very good. And reduction in the caffeine and alcohol, moderate consumption of the alcohol. So now on the basis of nutrigenetics and gene relationship. Nutrigenomics is a relationship between gene and nutrition. All right? What happens to your father, what gene does your mother or your father have, one way or the other may affect you as a child. And that proposes that disease can be prevented and reversed by drastically altering the nutritional environment. And what are the basic premises? One, people are genetically predisposed to develop some type of chronic illnesses. Okay? If your father or your mother or both of them they died of hypertension, there is a tendency that the children will also be hypertensive because of what is an inherited stuff. Expression of this is slightly influenced also by environment. And the environment, as I'm talking about, what you breathe in, all right, what you inhale, what you drink, what you are exposed to, and also what you eat. All this constitute the environment you find yourself. So environment can exacerbate the negative genes you carry. Environment can abrogate and can reverse the influence of that negative gene. Are you getting what I'm talking about? So even let me break it down. Even if your father had hypertension or diabetes, okay, and also you have a tendency not to be diabetic because you are taking it from your mother. But when you subject yourself to good dietary environment, it becomes possible for the dietary environment and exposure to override that inheritance. And you may not really manifest the diabetes, and what killed your father or what killed your mother will not kill you. And that is where knowledge comes in. Especially when you get to know that, oh, people in the family, they die of hypertension, they die of this and that. What do? Let me try as much as possible to see what can be done. You all know him, Pastor Matthew Ashimolo. You will see one of his video when he turned 70. All right, when he turned 70, you may go and Google that and listen to that video. You will learn a lot. I think it was, he went to the hospital, he was identified of being diagnosed of having hypertension and that kind of thing. And the doctors now say, you have to be taking drugs. Then he said, taking drugs. I said, the moment you start to take the drug, you cannot stop. Then he asked the next question, is there anything I can do? And he said, well, if you can reduce your weight and you can do some of the things, if you know, he said, is that so? I decided to choose the other way. I will not, I don't want to take the drug, but these other things I choose. This is lifestyle. And he embarked on exercise, he embarked on eating correctly, and ensuring not eating things that will predispose himself and his body to what to hypertension. And when you look at him, he had lost several pounds. He even said that church members were saying, let's begin to pray for pastor. Pastor is sick. Look at the way he told them that it's good that they are sick, that are not sick, that is deliberate, that is strong. And you can see him very smart and very strong, very articulate and strong. Why? He was able to use the dietary exposure and dietary lifestyle to be able to correct the situation. And that is exactly what we are talking about. So expression. So food is a large part of this environment and can affect gene expression. Whole food, plant-based, nutritionally dense diet positively influence genetic expression and the incidence of this disease. So what are the benefits of the nutritional therapy? It improves the health and well-being. It makes you to sleep better. It increases motivation and enthusiasm. All right? You are focused, better focused. Your mind is a sound. You have a loads of energy and stamina. You need energy and you need stamina to be able to cope with what? With the life responsibilities and days challenges. Without stamina, without energy, you work for 2 or 3 hours, you are tired. You walk around and you cannot do so. But when you take some of these, you are smart and you are active and you are able to do so many things. You don't know some of us, 24 hours is like it's not enough for some of us. You know how I work. Sometimes when some people are sleeping and snoring, I'm still awake. And I think I apologized. I called Mrs. Perry again. One day around 10 p.m. or 10:30, I just made a mistake because by that time, me, I was still awake and still working. After the phone rang, I said, it's not right to call a woman like this, especially a married woman. You don't know what is happening. And I was right. So she picked the phone and she was there with the husband, by the side, and the husband also spoke. I said, well, so it's because you were about to sleep for sleeping, but I was in my office. You understand? That time, still in the office and work. So people find out that how 10 o'clock, of course, I'm working 10:30. Before I begin to think of maybe around 12 or 1, then I wake up again, all right, and to begin, to work. But some of the things, as a result of what, of the stamina and many other things that I also complete. Because I learned this from my friend, and I call him a mentor because I learned so much. I was a visiting professor in Seoul National University, South Korea, in 2005 and 6. Seoul National University in South Korea, that is the #1 university, the best university in South Korea, and the second best in Asian continent, apart from Kyoto University. And anybody that is employed, either students or staff, to work in Seoul National University is a first class. They don't just allow anybody, and that is the truth. You can find that students, there is no talk, in the class, male or female, you have to be a first class person, and also the teachers. So before I was asked or recruited is on the basis of what? Of the excellence and certain things that they have seen. So when I got to the place and I started working, I thought I was hard working in Nigeria. Then I found out that some other people, they are from another world, from another country. I didn't know the import. I got to Incheon International Airport around 6:30 that day, and they came to pick me. I got to the hotel room by around 6:45 p.m. They put me there, and the guy, my dad mentor and one of the students who came to pick me, they said that by 7 p.m. they said that there's a dinner waiting and they want to entertain. I don't ask myself. I got to this place by 6:45. How can I have a meeting by 7 p.m.? Almost 48 hours a meeting. I flew from Lagos to Dubai. South Korea, that is like the end of the world. Very, very far. You can't get there in 24 hours. I just said to him, I want you to allow me to rest, not knowing that I was in for something different. And now, by 7 p.m., they started knocking. I was even removing some of my things. It's not 7 p.m. They say we are ready. I said, what kind of thing? I didn't want to say please, so I followed them. And of course, everybody was set and then had dinner. It was on Saturday. By the time we finished around 9 p.m., they said, see you tomorrow morning by 8 a.m. I said, tomorrow is Sunday. I said, tomorrow is Sunday. They say in this place they work on Sunday. No, they are Buddhists. They are not Christian. They don't worship any God. They say they work on Sunday. I said, for me, I don't work on Sunday. I said, I'm a Christian. They said, we work on Sunday here. I just started looking at them. What kind of people it is? We work on Sunday. I said, okay. By 8 a.m. I was there. Come and see, it was like Monday morning. Fully charged with human beings, running, working, expecting. I just sat down there throughout Sunday. I was working like that because I didn't know my way. The guy who came to pick me on Sunday, he took me back. On Monday, I still came again. He took me back around 7 p.m. 6 o'clock, 7 p.m. After it took me about 3 or 4 days, I think on Wednesday, I went to a meeting around 7 p.m. I said, it's time to go. He didn't answer me. I said, it's time to go now. He said, Dr. Farundi, he said, you should know the way by now. I said, but you should feel, let's go. He said, look, it's because you are new. He said, we don't go at this time. He said, because mentor has not gone. I said, who is mentor? I don't mention the name of that. I said, well, you people, you are students, that's your mentor. Your God mentor is my friend. It's my friend, and we are contemporary. We met at the conference. You can decide to wait. Me too, I'm a mentor. Where I'm coming from. I said, look, me, I'm going. Then the guy said that, well, you can go, but you will not go. So as I was going alone, I kept on thinking, because I learned, mentor has not gone. Therefore, you have to wait. Who is the mentor? Their boss has not gone. And therefore, it is very rude for the subordinates to leave a senior or mentor working and a student or subordinate you are working with me when your boss is still at work. And that is one of the problems in Nigeria. Your boss is still working, and you are the employee say good night and you go working. Then the question is that will you ever be a boss? Some of my students I also see when I'm working by 4, 5, some of them who are married, they say that want to go and they take care of their children, they say good night. I just shake my head. You are saying good night and what I'm here. So when I saw the way they were, so I went to meet that so-called mentor, my friend. I said, you're doing, first thing. I said, what is happening? When do you close? It's fine. He said, you get to know. You're fine. But he's always working. Then I found out that he sleeps for 4 hours. They close by 4 a.m. and they resume by 10 a.m. every day. Except his vulnerability. And that is what everybody loves. So I now look at myself, I say, well, why don't you also, because I wasn't a student, a visiting professor, I don't have myself here, I'm just alone. No meeting, no engagement, family is not here. No, why don't you also work? And work at the way you are working. And I decided to also work the way you are working. 4 hours of sleep every day, and we work all through. We were able to achieve a lot. And now see the reason why the whites and people like that, they make a lot of work of the progress than the black people. Most of these supplements and most of this shanty and great, all these things you are buying before this, that is actually what we do in that laboratory. The laboratory is called Laboratory of Cancer Chemoprevention. I'm into that, and some of these drugs have participated in making them. That's what you do in that lab. Television people used to come every week to ask any discovery and stuff like that. Stuff like turmeric, curcumin supplements and most of those things. Those are the things after we have done extensive research and we get them into the industry, collaborate with the industry people, and they are the people that they use to authenticate the products that they sell to them after we have done the science. So the guy works like anything. But one thing, now listen, when you see him ever looking so young, no gray hair, in fact, his hair was always a shiny, whether I do small or whatever. Very smart and active. Now, enter his office. When I then enter his office, that is where I discovered this stamina and energy. I saw a lot of the supplements. I saw a lot of they take what we call ginseng. Ginseng is part of the forever list. What we call poison, what we call ginger. Ginger, that is forever living the product, is not really on brand now. I think we should tell them to produce ginger. A very significant component of it is a ginseng. Ginseng is a native to South Korea. In fact, you cannot, it's like their crude oil. If you tell the seed the way it cannot grow, they grow it in a secret and special place, like a whole city dedicated for it. They export it all over and they make a lot of money. You will see a lot of the ginseng energy and stamina producing stuff that the man takes. I say, no wonder you are this strong and active, and that is exactly what you're for. So, what you eat like this can make you to be strong, can make you to have unusual energy to cope with all the activities of the day. So, release from unexplained pains and aches and itches, stuff like that. Younger skin, you look at the skin of some people, it's like that of a baby, and they're in their 60s, and they're just looking, so not too much of the wrinkles and stuff like that. Whereas some women, rather than to invest in that, they might be taking some cream and some things. Some of these things have the terrible side effect. At the end of the day, you will not like your skin again. But natural product can actually make you have that. Improve the blood circulation, strong heart, lungs, tissues, bones, reduce reactions to toxins and substances, improve hormonal health and mental health, prevention of the cancer, infections, and many other problems. These are what the nutritional benefits of what we take. So you can categorize some of these into two: micronutrients, like dietary supplements, vitamins and minerals, and macronutrients, like balanced carbohydrate, balanced protein, balanced this and balanced that. Now, you can also, this example of the micronutrients, the vitamins, then the macronutrients, the protein, carbohydrates, the healthy fats. There are healthy fats like the nuts, fish, salmon, vegetable oils, and seeds. These are healthy ones are fats you want to take. And little carbohydrates. Everybody should know that little carbohydrate. It's been said that when you want to eat pounded yam or eba or apple, it's a feast. All right? Like it should not be more than this and plenty of the food. Not that you now take a big bowl like this and you are taking it, wrap it and taking it, and you have it, and you are even begging for sponsors. Help me to sponsor. You are loading your body and your system with the sugar. You can worry because those things give back to what? Give back to sugar and carbohydrate. And that is one of the reasons why you are fat, your stomach is big. I remember one of my PhD students is a lecturer now, Chiagoziem Ochuechere. And he came one day and I looked at him. He's looking bigger and older than myself. And I said, young man, I said, both of us, go anywhere. They are going to prostrate for you before me. Look at the way you are holding. I mean, looking so big stomach. I said, why is your stomach so big like this? And he explained, he said, the wife will just happen for him. It's around 9 p.m. I said, so can you say, okay, the young man is already developing cardiovascular problem. When your stomach is so big like this, it's very close to the heart. That's what people don't know. Big tongue is close to the heart. So with time, you are likely going to have heart issues. So it's important to actually correct this and like that. So invest in what? In plant-based phytochemicals. And plant-based phytochemicals are plant-based but highly processed, additives and added sugar and less nutrient. Do not invest in a processed foods. Processed foods with additives, with added sugar and a less nutrient. You go and fry cheese. Fried cheese, fries. Look at these cookies. Look at this. This is a process. And many people like this. It's so sweet, so tasty. Many people like, especially women. Sweet cake, sweet. Some of them are looking at me. They like the sweet cake. It's very tasty and stuff like that. But you should take it even if you take in moderation, not in excess. Now, plant-based, all food ingredients full of vitamins, minerals, and when you look at this, this is onion, raw. This is a tomato, raw. Look at this, raw. And this is pepper, better than this. Okay? Now, some indigenous plant-based phytochemicals and healthcare. Red palm oil is a one. Many people don't know. Very, very good. Very, very useful. Very, very important. It's native to West Africa and has been there over 5,000 years ago. A major ingredient in red palm oil is called tocotrienol. The tocopherols and tocotrienol. Very, very effective. Has anti-inflammatory properties, antioxidants, and a lot of effects. These are some of the benefits of the tocotrienol in red palm oil. It prevents a brain death. It has effect in improving the brain function. It reduces skin hyperpigmentation. It improves skin and hair. It's very effective in the maintenance of healthy bones. It improves gastrointestinal health. It improves the heart. It reduces the risk of the several forms of the cancer and protects the brain. And these are what the things that the tocotrienol found in red palm oil can actually produce. I've shown this before. This is Oratin and Mobility in collaboration with my friend in Japan, Dr. Takiji Tanaka, in the Kanazawa Medical Center in Japan. We were able to isolate, yes, it's a Japanese, isolate is a professor of oncology, pathology, into form of what of mechanism of the cancer. Nice guy. He came when I was visiting professor in South Korea, and after that we collaborated and we were able to do this together in Japan. And then you can see this, and these two components are from there. I've shown you before of the how to drink orange. Many times when you drink orange, you take orange, the sweet one, you take it and you throw the others away. You take it in the second one. Don't take the sweet part, the sugary part, and you take it away. You are not eating correctly. You are only drinking and eating sugar. That one that you throw away that goes chase and eat is good that is a benefit. Yes, because you have thrown away important things. Okay? This part, this whitish part, contains a lot of what? Of the flavonoids that will save your life. And this green part that you shave off and you give to goats, when you look at goats properly, especially that the skin is always shiny because of this thing that is consumed. If you decide to take this, your skin will be shining like that. Though you may not, I'm not saying you should be taking what? The skin of orange, but there is a better way of taking it. Now, this is it. So when you take it, you may leave this. Then this part too, you take this, you don't throw it away, you eat the raw things. It helps you, fiber is inside, and the skin, out of it, you may boil it for 10 to 15 minutes, and then drink the water. Then you are taking everything that is inside the body, and not just the sweet part. The sweet part that you take is just sugar. It's just sugar that you are taking, and you are not getting actually the best. When I get to a place, I always like a complete mixture of a fruit where you blend everything together. Some time ago, I was in Chicago, and there is an hotel that we stay with some of my colleagues, and we went to a restaurant and we were eating, and the drinker, some of them were ordering for this, and I saw this guy who makes fresh fruit, and I asked him to blend everything, about 5 different fruits together and blend, and that was what I took. The others were taking Coke and sugar. I just looked at them, and that was what I took. People don't mind, more expensive. You take that one glass of a 5 fruits blended together with a very powerful blender. Apple, apricot, and this orange, about 5 different types of food, everything blended together, 1 cup. Just take it. I tell you, within 1 hour, you begin to feel the effect on your body. You begin to know that you are taking something. You will feel happy, you feel good. The energy, the stamina, if you are having headache before, you don't discover that you are just okay. Why? Because of that. So, it's part of what you are supposed to take. Of course, you have this at the back of your life. This is the bitter leaf, and it's very important. Though it's bitter, it is good. Look for you to take from time to time. You cannot go deep into this. This is a compound that has been isolated from you. It has a lot of effect, like this. And I'm talking about this. I choose to talk about this today. This is a way Yoruba people, you will know about this. All right? You won't find it in Igbo land. You don't eat it. Sometimes they don't even like it. It's not correct. You like it?
We have adopted it. We have adopted it.
Now, okay, in the place, you grow it. Okay, that's
we have discovered the
difference because we don't use room. That's the room is the cocoa.
All right. Go tell the people that are there. Many, including either the Yorubas or the people, they do not know the value, and they don't eat it or consume it the way they should consume it. and how they should consume it. Alright? Whether you blend it or you use the fruit to convert to this, alright, or leave it like this, and this is a traditional Yoruba meal, and this is common the way they eat it. They put stew here, the Igbo people will say, okay, man, that the oil soup, that you put, you make a soup, and you put stew separate, and you think that is not the correct way. The number of eating fine, that is okay. Well, this one, I pick it like this is the way they serve it, to somebody. But the emphasis is this, and this, not really this. Even though this that is brown has a lot of advantage I don't want to talk about today, I can talk about it for the next 6 months, because this is what I worked on for 7 years, and I took kg from this. And I will not tell you the advantage or advantages of this. Everywhere I go, I take this at least a day. Even in US, in Canada, anywhere I go, because I know many people do not know. And except I tell them and I teach them and explain to them what this can do. It can do. The color is something that makes people not to like it, but the color is what actually is responsible for some of the things we're talking about. Anyway, we won't talk about this. But this is what Oros Orientorius will do. Very, very important as that is the chemical, don't bother about that. I just chose to remind me as it is now. This has a lot of words of a medical value and advantage. And many times, this one is a book. Most times, I don't take it in cook form like this. I actually take it raw. For many years, Papa is even saying, and I will explain to you how I take it because how it is. Now, you get it from the words, from the market or where. Just remove the leaves. I ask the young ones to remove the leaves. And because, the environment is contaminated, you cannot take. So I wash it myself with salt. Okay. With salt just to kill the bacteria. Instead of washing with salt to kill the bacteria and wash it properly. And remove the salt. After removing the salt with the clean water, it's not clean. I have a specialized blender, small. I order for it and I take it everywhere I go. It's very small and I can blend, so I don't need to carry it in the blender. So we just put it inside the blender and water and I blend it and one cup and you drink it. Just like that, raw. And it looks like it's tasteless, it's not bitter, it has to be taste, but it has no taste. It's not a sweet, it's not bitter, it's nothing, but just drink it like that in the morning. Alright? When people see me like this, you can't guess my age. Some people say it's a small boy. It's not a small boy. Somebody that people are taught in the university for 35 years. Jesus. So if I've been a lecturer in the university for 35 years, then and I've been a professor for almost 20 years. So out of that, so I'm a professor of 15 of my PhD students are full professors. Even though when you see some of them, they are white, but you cannot see gray hair here. But people don't know the secret. One of the secrets is what I'm more or less taking out to people. What can legally manage to eat akam or palm is under the leaf. The Baba will cover with leaf and the children say, what are you eating? Nothing. But they don't know that. Because under the leaf, you always see that. So there is one. It's very, very important. Now, look at several advantages. It's very rich in antioxidants. Vitamin E, right? Vitamin E for people in terms of the fertility, in terms of the boosting sperm, all right? You need vitamin E. Vitamin A, it is important for clear eyesight. In fact, it's one of the remedies for it, as you will see. It prevents aging of muscle. It strengthens the bones and the teeth. Why? Because it's rich in calcium and phosphorus. Sometimes we make a mistake. I know we make a forever calcium calcium, and we recommend that for bones and all that. It's not the only problem, it's not the only solution. Because people don't know. Your bones are not made up of the calcium alone. No. There are about almost 10 to 15 elements that make up the bone. So taking calcium alone may not even make your bones to be 100% strong. Calcium and the phosphorus especially are there. Taking that calcium together with what? Dark, green, leafy vegetables will make your bones strong. And this qualifies to look at how dark green it is. All right, it strengthens the bones and the teeth. It also stabilizes the blood pressure because it contains omega-3. All right, it's a present there. It helps in hormone stabilization in women. It helps the premenstrual syndrome, all right, in women and other things. It improves the brain health because of the presence of omega-3 fatty acids too. And some of the components there are able to cross what we call blood-brain barrier, and it can enter the system and be able to assist in a number of problems and issues that you have inside of your brain. It treats inflammation. All sicknesses and diseases, the underlying issue is what is inflammation. Is it cancer? Is it diabetes? Is it the cardiovascular disorder? Inflammation is underlying. Protects the eye. Many people recommend this actually for people who have eye problems to take it regularly because it contains 0.496 milligram of vitamin B6. We call it pyridoxine. And that is over 30% of the recommended daily value. And this is useful in improving ISI. The next one is onions. All right? Many people don't like to consume it, especially raw because of the smell. The same way you don't like to consume the garlic because of what? Of smell. But there is a time to consume it, and there is a way to consume it. I think I'm giving out too much information. Yeah. Garlic and onions, they come from the same family. From the same family, botany, and that is why this is very important. Now, garlic, you take it of course, your body may smell and your mouth may smell. But there is a better way of taking it and will use. Why? If you take this in the morning, after taking it in the morning, all right, they brush well. Clean your teeth, brush very well. It's not going to end it. After brushing it, maybe about 30 or 40 minutes after you take it, then eat normal food. By the time you take in normal diet, all right, it will reduce the smell in a way. Then the next thing is that after about 30 or 40 minutes you take in the meal, all right, then there is something I'm going to talk about later. Then you can take about 1 seed of the bitter kola and then take the bitter kola after that. It's going to kill any form of the smell arising from onion.
Quality information. Thank you, sir.
So wherever you go, find yourself, the fact that the is a norm. By the time you take that, you will have successfully, suppressed the smell. And you get the advantage of both the bitter kola and there's an advantage of all of the onions of the garlic. This is what I was able to find out by practice and by experience, which I found out myself because I invest a lot, in the both. So onions, have also many benefits. They contain antioxidants. It improves digestive health. It is loaded with nutrients. I think there is let me show this here. Let me show you before. Look at, you have white onions, you have yellow onions. It's good for you to know the nutrition fact. Look at it, the total calories 43, total fat is 0. You are saying what you should eat that will not make you to be fat. All right? The total fat here is 0, so you are not taking fat. The fiber there is 1.2 grams, which is high. You need fiber. One of the reasons why many years ago, people in the Western, in the West, like in Nigeria or West Africa, who do not develop a gastrointestinal form of cancer is because of the high-rich fiber food we eat. The eba, the apple, the amala that we eat, but it's very rich in the fiber. So when you take that inside of your system, any form of a cancer-causing compounds or agent, rather than more or less damaging the intestinal mucosa, will be more or less absorbed by the fiber rich your food and you pass out. So you find out that by regularly taking that, your system is not going to be loaded with what? With the carcinogenic substance. But lo and behold, you are changing your dietary habit. You don't eat some of the things again. You eat rice, you eat indomie, you eat the spaghetti, you eat all those Western world, and you left your fiber-rich products. No wonder colorectal cancer is on the rise. In Lagos here, in city today, I'm telling you statistics because I work on colorectal, is the third leading, a cause of the death in major cities in Nigeria, especially in Lagos. Male and female, third leading cause of the death, colorectal cancer. And before you know what is happening, it has metastasized, and stage 3, stage 4, and the person is dead. Why? It's because of the kind of food that you eat in this type of thing. Epidemiology and what you say, you go to major hospitals, or go to villages. Go to villages, go to those interior, you will not have that. Why? Because of the kind of the food that you eat. So it is high time to have a dietary lifestyle change. So you see, the yellow onions also like that 0. Look at about 3 grams. Okay, proteins are like that. Look at 1.2 grams. The red onion 1 gram. So all sorts of onion, whether white or yellow or red, they are very, very good. So, as I said, loaded in nutrients like potassium and manganese. It has anti-inflammatory properties. Why? Because it contains this compound quercetin. It's in the supplements I'll show you soon. And it's also quercetin that you see is called a transporter, zinc transporter or ionophore. Many people do not know the principle of it. During coronavirus attack, one of the things the doctors will tell you to do is that if you can't take a zinc, plenty of zinc, and what? Take vitamin D3 and vitamin C and all that. All these things we were prescribing at that time is based on what? Is based on mechanism of action of this. And you remember there was a time they were prescribing the use of hydroxychloroquine, repurposing hydroxychloroquine more or less an anti-malaria agent, but for coronavirus, they repurposed it in order to be able to kill the virus. And it was very effective. But politics did not allow them to actually inject it well. They wanted the vaccine, and the vaccine, because of the money they wanted to make from the vaccine, rather than that, they dropped natural products, they dropped this, and they dropped that, and they advocated for vaccines because of what they wanted to say. Last time I came, I told you of not less than 7 to 10 people that I was able to cure the coronavirus by what? By just prescribing some of the things that I know. And including the chief medical director of the teaching hospital. Yes. Who caused the virus? He caused the virus from somewhere, I don't want to mention the name, a very big person that was in Gwari that time had the coronavirus and he didn't know. He just came from outside of the country and came to that university for an interaction. And a word like this, he spoke. He held the microphone and he spoke. All the 3 people who collected the microphone in rapid succession called the coronavirus. The principal officer and the CMB was the best person who collected it. Within 1 or 2 days, started manifesting. And it was the early stage, everybody was afraid. This man, he too was afraid because they didn't know the behavior. People were just dying. So he was afraid. But I was afraid, but I was not afraid, I was smiling. I said, look, I know what will help this man if he will listen. Luckily, My wife is a doctor, as a consultant, and then they work together. And I asked my wife, I said, look, this your guy, doctor, who will not always listen to natural people. Do you want him to die? He said he wants him to die. First of all, call him, tell him that I know what will make him to be. Oh. So she called. And when she called him, he said, well, what is it? I said, I now made when I'm going to meet 1, 2, 3, 4, 5, 6. I gave to her instead of tell him to do this, to do that. And the man obeyed. Within 1 week, it turned negative. He repeated the test again. The next other week, it was negative, and he came out and started working. So when he was now working, he now went to the platform, WhatsApp platform of the hospital consultant people. He now said, I think he must advocate for some of the natural people, and they started abusing him. How can you, a doctor, a chief medical director, be talking something that they have not experimented, something you don't know whether it's not, and you are saying people will be taking that? The man was saying that all these things you are saying, you are doing grammar. Look, I took this thing and I'm okay. So I can tell everybody, even though we may not know what is this, that I just started laughing at all. I said, you may not know, but we know. We know, and it works. And one of the things they say that they may not know is that they have to take zinc. What we zinc? Zinc is very, very important. Okay? Now, quercetin is very important. It allows zinc. What zinc does is that when it enters the cell, it's able to inhibit the replication of the coronavirus. And when the replication is stopped, then you will be made whole. But what happened is that ability of the zinc to penetrate the cell, enter and go and meet coronavirus is so low, it's very difficult. So you need a transporter. You need something to assist zinc to move fast. And one of those things is what hydroxychloroquine does. And people do. So hydroxychloroquine is a transporter ionophore for zinc. When you take zinc with hydroxychloroquine, it makes it to enter quickly and it will stop the movement and replication of the virus, and the person will get better. But hydroxychloroquine, being a synthetic drug, has some toxic effect. But what is the substitute now for hydroxychloroquine? Onions.
Chicken.
Onions contains quercetin. Quercetin is a zinc ionophore and transporter. So when you take zinc, and also you take onion that contains quercetin, it facilitates the entry of the zinc into the system.
Chop.
So you are seeing how that works. I was inside hospital with not less than 4 coronavirus positive people. And I came out of that place without even testing positive. People don't. Yeah, I was a colleague of my so I was with him. They are not diagnosed that he had the coronavirus, better diagnosed, and it was inside the hall. People were using, I never even used a nose mask. Because it does not make people to breathe. Don't let me talk about that. I didn't use. But the point is that once I take and consume, even if a virus comes immediately, that thing will just fight it and drive it back. When I wake up in the morning and I take this effective cocktail, very, very, very terrible cocktail that I mix together, I don't miss it in the morning and I walk out. But when I walk out with coronavirus, it can't. Because my system is loaded with plenty of those cocktail that we never want to see coronavirus. When coronavirus comes, the thing will just kill. But people will not, because so many that I will take almost 6 or 7. Even if I was taking 5 at that time, I blended any of them and I put 2 spoons inside. When I put spoons and I take to the bath and I look at that, I never coughed. Not for months. So nothing is found. Now, it also works, it keeps the cancer at bay, it reduces risk of Alzheimer's disease. Alright? And has antibacterial properties because of adhesive, which it contains. What is it at the time?
127.
Okay, that's good. All right. Let us help also in fighting this. These are the things that we find in words. Very, very important. So the dietary supplement, nutraceuticals, this is a secretary who discusses. So nutraceuticals increase life expectancy and prevents all these diseases that we have talked about. And quercetin, you can call it a nutraceutical now. It's a supplement. It is found in this. It is found in all these other foods too, and vegetables that you can also get quercetin apart from onion. But it's particularly rich in onion, and the concentration of quercetin in onion is higher than most of it.
Okay.
So you could try, mentioned it before. Here is a turmeric, and the curcumin has a lot of effects. And antioxidants, look at all these things blended like this. As I told you, 1 cup. Look at it. Let them blend all this and select and blend 1 cup for you and take down 1 cup. You will feel it within 1 hour. You are taking it because of the number of things that are there. And it's been postulated that in not a long time, many of them will be in form of the medicine that the doctors will now begin to prescribe to people to use that. And of course, it prevents cancer. What is called chemoprevention, that terminology. A phenomenon whereby the long-stated process of the carcinogenesis is prevented, abrogated, delayed, postponed, until maybe the particular time that you are completely done with the process of chemoprevention as more or less postulated by this one. So chemoprevention increases lifespan by delaying mortality. It decreases incidence of diseases such as cancer. So, this group from the United States, they've also advocated this, and it can enter this tablet form in form of the supplements that we are talking about. So someday, people should be able to avoid cancer and other diseases for its onset by taking specially formulated pills or foods. So, I've spoken about this before. This is the Coca-Cola Senior. All right? Very important. I love it so much. I eat it regularly. People say I'm the one that makes it to be very expensive now. So, since I started talking about the coronavirus, it became very, very expensive. I was on the radio and television virtually every day, talking about how to prevent this PCOS people are not today, right? From time to time to educate people. And because I work on this, I know a lot that it does. All right, it's very effective in liver disease, bacterial infection, inflammation, bronchitis, cold, sore throat, sore, and impotence. All right, very, very important. In Cameroon, I was in the United States in Jackson, Mississippi one day and gave a lecture, and a woman from Cameroon, she came to meet me. He said in Cameroon, they call me Mr. 4 a.m. And I said, why are you calling Mr. 4 a.m. in Cameroon? He said, because when they are men, when they take it the day before or in the night, by 4 a.m., something happens. They are mad, this thing, becomes something. They call him Mr. 4 a.m. So I smiled because I know the reason. And a few days ago, I was at a mechanical, workshop of one of my technicians, and one elderly man was eating it, and a young man was eating it. The boy said, I don't like to eat this thing. He said, because each time I eat this thing, I always have a long direction. I just smile. People will say, I don't like eating this. Each time I eat it, because that is one of the things that it does. We cannot go into details of what Coca-Cola can do, several therapeutic purposes, and is able to do it. It's always present in traditional naming ceremony, especially in the West. Many times the traditional people, They never name a woman, they never name a child until bitter kola is expressed. They use bitter kola to pray for the child because it's associated with longevity. Good for longevity. The Yoruba people, they do so much in it. It's a robot, inside it. It's a good believe that's it. I saw what Ládùn lábálé oníyọ̀, adùn nítorí adùn nítorí. You want to understand, I'm speaking in public. Right? They say some of it, I think they say when a child is to be named on the 8th day, traditionally they take bitter kola, they take alligator pepper, they take kola nuts, they take salt, they take sugar cane, right, sweet, and they use all these things to actually pray for the child that all these benefits. It is in the college child. And now, we scientists in our name, having done the experiment, we can confirm what those forefathers actually said about. So, you have some of these. Most of the things that we have talked about since the beginning, they are present in all these products because they have been isolated. They have been characterized from these plant-based phytochemicals and are now being concentrated in form of this supplement. Like I said, all these food, how many people will have time to go and buy, a wedu every day and be blending it? Not everybody will be able to do that. Even to take orange or to even eat apple, people are so busy and you are working, so hard that you don't have time to actually take this in a raw form. Okay? But through methodologies and science and experiments, it's been possible to actually pick and select these compounds and the chemical compounds and the phytochemicals and put them together in order to be of importance to me. And these are the things. You have aloe vera gel, very important. You have a vitalized, you have a thyme garlic. For those who cannot take it raw, because you say it's a smelling, all right? It's like this. You have active C, you have Forever Freedom Active HA, you have a living immune blend. This is actually what introduced me personally to Forever Living a product in immune blend. Before I used to have a cold that was almost on a protracted basis. But when I started using this, I found out that just a clear and I said that there must be something exceptional in the piece, and that is the one person. So you see there, this is the active seed, this is the immune blend that I started taking, and since I started taking them, I found out that I was completely free of both of the cold and flu and the catarrh and the sneezing. And it's on the basis of the correct formulation of the anti-influenza agents that are contained in this. This is a forever move, attracting the patients and people that have inability to move, all right, stiffness of the legs and bone is very important. I get this from my mom of the 90 years old. She takes this and assists her a lot. Then you have a time, you have a vitalized. This is important for prostate health and maintenance of what? Of the healthy prostate and prevention of the benign prostate hyperplasia and ultimately prevention of the prostate cancer. You have the multi-marker. Marker roots is there. It cures the impotence. It produces a wild energy, for people, and the people who have a decrease in libido, all right, is also assisted them tremendously. You have a Forever Freedom. It's also important in relief of the joint osteoarthritis and pains, and because of the presence of the glucosamine and a compound of protein, and that is exactly what it is. Of course, the aloe vera gel is a source of the vitamins, also of vitamins and natural detoxifier and anti-inflammatory and has a painkilling effects, and also improve the general wellness and also they boost the immune system of the body. You have what? The royal jelly, you have that, you have the Garcinia Plus. This is Garcinia Plus is made from the Asian Garcinia called Garcinia Cambodia. Garcinia Cambodia, that is where they make this one from. The one I showed you before that we eat here is called Garcinia Cola Rotiferi family. They belong to the same, but they are a little bit different. And one of the things that Garcinia Cola and Garcinia Plus does is that it brings about reduction in weight loss. Weight loss is very important, and the forever lean. Forever being folic is very important. That is from honey, original honey. It is very, very rare to have original honey nowadays. You have adulterated honey that they have added plenty of the sugar, and that is not the healthy for you. But you have to notice. All right, forever AKA hyaluronic acid is a blessing in this, and the acid, all right, in cartilage formation and the bones, and the forever moon contains a curcumin from turmeric that I showed you before, and because of the very strong and potent anti-inflammatory property, it's very healthy for cartilage maintenance, and they also decrease the stiffness of the muscles and joints. And so forever active is very important. Omega-3 fatty acid, including EPA and DHA, dihydrotestosterone, and the sulfamento are present in it, producing dihydrotestosterone, the hormone that causes unchecked multiplication of the prostate cell. So whatever is in this, one way or the other, prevents the formation of this. It also contains the lycopene and a percentage. Lycopene is important. Lycopene is present and abundant in the tomato, and it contains this antioxidant, the carotenoid, that is important, and because it's a very strong quencher of a singlet oxygen that plays a negative role in the formation of the prostate. So, and also quercetin that we discussed before. So these two, they work in tandem, okay, also for prostate, and they also work together, for maintenance of the healthy heart, and also brain. The brain functions make your system to actually function effectively. So, as we see from garlic, lycopene from tomato, docosahexaenoic acid from fish oil, eicosapentaenoic acid EPA from fish oil, and sulfamento for PPH. They have been used in a clinical trial, right? Like for garlic, this is the outcome of the clinical trial. It improves antioxidant status and all sorts of things, and like this. And for DHA from the forever active C and EPA, it's been shown to have effect the reduction of the triglycerides and the prevented cardiovascular dysfunction. These are some of the clinical trials that have been done with this. Lycopene, this is the clinical trial. It's reducing prostate, cancer, and the benign prostate hyperplasia significantly. This is the clinical trial that has been done, and you can see the benign prostate hyperplasia. And this is what happens. This is the bladder, all right, for male. All right, this is the urethra, the part in which urine passes, and this is a prostate. All right, a healthy prostate is supposed to be normal and is not supposed to impinge on this. But what happens is that there is a proliferation, all right, a atrophy of this, and what happens is that it begins to shrink the urethra, and if it shrinks it too much, you find out that the urine will not be able to pass, and you find that the urine stores in the bladder. And when urine stores in the bladder, and that is a lot of the problem. It's good not to experience this as a man. It's a lot of the problem. Within a few periods of the time, somebody you know that you are in a different world. You suffer, so it's not good enough, and that kind of thing. So this is one of the problems. The solution is that you use drugs for it. Plant extract. They can use alpha blockers. Doctors will prescribe alpha blockers and 5 alpha reductase that reduce the formation or synthesis of dihydroxy testosterone that more or less brings about proliferation of the cells of the prostate that makes it to be enlarged. And the beta-3 agonists and phosphodiesterol inhibitors. These are drugs, but they all have side effects. Some of the side effects of this alpha blocker is that, one, it reduces the libido. And people that they prescribe this for, you may be free of that prostate problem, all right, and be able to urinate well. But the severe side effect is that you will have little or no erection and the complete loss of the libido. And therefore, it's better to then use a plant extract that may not have a side effect and you will still actually be normal. So we also did this test and with salt and method that is present in the electrolyte to be able to prevent prostate hyperplasia. These are examples of what of the reduction in symptoms as a result of what treatment with the yeast. You have excellent at the end of the day. So in conclusion, we can say the phytochemicals owing to their intrinsic antioxidant effects are able to manage numerous diseases, and therefore phytochemicals and supplements as appropriate dose or promise in managing ailments, and forever living supplements have been proved to be effective, and they may therefore qualify as a new therapeutic signatures and multi-targeted agents for prevention of the chronic diseases, any form of chronic disease, from head to toe, cardiovascular disorder, diabetes, hypertension, and cancer of all sorts of the site. And we begin to tailor nutraceuticals and chemoprevention for the prevention of one of the chronic diseases. And I leave you with this last slide. This is a recent award that came up about 2 weeks ago. 2022 World Banking in the whole world. It's a very big award and it's gladdened my heart. The Stanford University in the United States, they conducted a survey of all the scientists in the world in all forms of science, the physical sciences, medical sciences, biological sciences, and they ranked the people that enter into this list and a world of 2%. And I have been featured in the list. Thank you very much.
Thanks, I'm sure we learned a lot. And I believe some of us have some questions for Prof. So let's see. Do we have anybody questions? Do you have any questions for Prof? I have a question for Prof. So I'm just going to give you one question. I'll ask you.
Good afternoon, everybody. Good afternoon. Prof, thank you so much for the wonderful presentation and knowledge you have given us this afternoon. So my question is, you mentioned when your energy is increased and you work harder. So how do you now manage to get enough sleep when you work till up to 1 or 2 or thereabouts? I'm doing that I was supposed to get up to 8 hours of sleep. Thank you.
Should we take more questions? Well, I think so. Okay, second.
8 hours.
Thank you. Good afternoon. Please, my question goes, when Daddy said that, the doctor said that he treated someone that has a coronavirus. Please, I want to know more about that. Thank you.
That's almost school fees. That's almost school fees.
Good afternoon, Doctor, thank you very much. I wanted to ask, do you have a book that has all these benefits? Do you have a reason why and yes, I'm interested in too? I want to know about the fruits and stuff that grow here in tropics. Like how much research have been done in it? Because most times I see grapes, I see strawberry in Western world that has been grown. How many of these ones that have been grown here, that is indigenous ones here, have been used for medicine as proper research has gone into? Because I believe there are still lots of things that are yet to be found. How much research has been gone into that?
That's what I first.
Thank you, Prof. Your lecture was very good. That's much as I'm not very good at listening to long lectures. I could read. Well, I want to say a lot has been said about plant-based foods that we eat. Down here, could you enlighten us about which one is better? A lot of people have been pushed into throwing a lot of herbicides, fertilizers, and things like that. What is really the organic type of foods that we should be taking? Because for me, I really don't like this fertilizer based food. They don't stay in the store, and most times maybe they get to, maybe because of science, I don't know which side they are on. They get very mature quickly, more than what you are normally used to naturally. So which class of this should we be taking more? And how do we take them? Because I do a lot myself. Thank you.
Yeah, thank you very much for talking about it. It's a very, very good question. Because I work late like that. And sleep is very, very important. You should, because we show that adults will have not less than 8 hours of the sleep per day. People who don't know, I told you before, India from so when I say I walk, that's something. One thing is that when I speak like that, if not because if there is an too much important meeting or whatever, you will never find me out around 8 o'clock or early morning from you. You understand? I don't go out, that's the end. I'm a late worker, and by virtue of my work, because it's I know that I also don't sleep very well to be able to achieve that, and not by waking up by 6 o'clock or 7 o'clock and start rushing out there to do whatever. No. Really, I've reached the stage by the university. I have a sort of opportunities, and people who have paid my dues.
Let me see. Oh,
if I don't go to work in 1 week, nobody can arrest me. That nobody can tell me why didn't you come earlier? Why have you not arrived in 1 week and not the So you understand. So I take my time to sleep very well and be fresh before I go out. When I do that and I need to go out, what I also do that I forgot is important. I have a nap in the afternoon. People it is 1 hour. You understand? It's very, very important. So if you get to my office is like a second home. There's another companion that is like a 3-seater sofa there or whatever. I lie down and sleep about 1 hour and I'm fresh and I come. So when you look at it, I have a good sleep. So good sleep is very, very important for your brain and for you to also function well. The person who wants that people that were treated for coronavirus is not something that we can talk a day or in a lecture, and like there are so many things that one may need to put together to take, actually to be able to work to look for an individual. We know some of them are mentioned, but some of them are specific. It's not only for coronavirus, anything called virus. Influenza virus that we have, like Qatar, is not too different from coronavirus. Only about 30% is different. So it belongs to the class of what of the virus. You understand what I'm talking about? When you have cold and you are sneezing, it's a virus. We call it influenza virus. Influenza virus is what causes that. All right? You have Ebola virus, that one that affects the skin and that kind of thing. So you have all sorts of viruses, and some of these things that we are talking about will have a positive effect on virus. One, bitter cola is important for it. Regular intake of the vitamin C is also very important, and the zinc and vitamin D, they are very, very important. When you take that, your immune function is improved upon, and you find out that the average will you actually develop anything in form of that. Those things that are mentioned to do that. And of course, if you are somebody who invest like a mixture of a ginger and a garlic, okay, and you put some turmeric and you blend together and you put in hot tea and you take everything in the morning regularly. These are the things that you take inside the system that make you to be strong against any form of the virus, including a coronavirus. I think I've been able to mention a few. Someone said, do you have a book that you do? Of course, most of the things that I told you about, they are products of the books I research. Because this is a public lecture, and I don't want to sound too technical, so that otherwise, if I sound too technical, we will not understand, and maybe some of you will have left. So I've just simplified it and speak to you as a layman and women, and I'm not somebody. If I'm maybe giving a lecture at a scientific conference, I need to go to technicalities of that. There are books, there are journals. There are articles published all over the place. For instance, the bitter cola we're talking about, I worked on it in not less than 4 or 5 continents of the world. That is it. I worked with it in the South Korea, where I told you about. I've worked with it in the United States. I worked with it in the Denmark, in Copenhagen, and also in a place there in Denmark called Aarhus, University of Aarhus. I worked with it in the University of Jena, in the Germany, right before, and we have worked with it in South Africa in the Cape Peninsula University, Cape Town. So, but all the places we work on this, and we have a published paper. If you go to Google or go to PubMed or databases and type my name, you will see a lot of our papers. And actually, these are some of the things that are culminated in this award of being listed in the world of top 2%. So we have the books and we have the articles and journals. All that we are talking about, they are products of the conducted the research and experiment. But I don't want to be too technical here, and I cannot afford to do that. He said, fruits and vegetables, how many of the topics have been done on local plants? Yeah, you are very correct. Most of these things are fruits and vegetables that I showed you. There are a lot of indigenous plants that have also been worked on. As I said, I cannot talk about all of them here. All the research on bitter cola, I've not talked about them. Research have been done. All my research on the bitter leaf, I cannot talk about them here. All my research, activities on some other medicinal plants that I've not mentioned here, and which other people too have done. They are there. And one advantage is that we are blessed in Africa, especially Nigeria. We have an advantage that the whites don't have. And it's unfortunate, and government is a problem. They do not support local research. And very, very unfortunate. All right? In 1995, I was in England in the Liverpool, University of Liverpool, and that was my first postdoctoral experience after PhD. And I was to work on something different with my boss, Dr. John. And I saw a thesis that was written by a British man, Alan Woodall, and the title is Carotenoids as Antioxidants and Fluoride. Within 1 week, I had read that big thesis, almost 400 pages. I had read everything. I just went to meet that white man. I told him that I'm not working on what he wanted to work on before, that I want to work on this thing. I said, he said, what do you mean? There was an agreement before you came for Nigeria. I said, yeah, but I've read this thing and this is what I want to work for. He said, no, that is what you agreed that I must work on. So when, I just look at it, say, this man wants to, and I told me that this man does not know that he's living with the work. I said, fine, I will work on both. The man said, are you an jealous? I said, don't worry. Say, the one that we agree on, you want it to be done, I will do it. This other one too, I will do. Even if you give it third one, I will do. The man looked at me like, what kind of person? I said, don't worry. And that was what happened. So I decided to work on the truth. The white people, they are so lazy. You're a black man, you teach the white people, how to work. I'm telling you, teach them how to work. And they're so lazy. They come by 9 a.m., our schedule is 9 to 5. They come by 9 a.m., and when they come by that 9 a.m., like 10 minutes after, they go and get tea on the food and get some snacks. They work by 11 o'clock or 12, they say it's time for the extended period of lunch. They will go there. By 3 o'clock, they say somebody is doing party, there is cake on the ground front. They go and take cake, they come back and work for 1 hour again. On the dawn of the fight, night, the fight are on the bed. So I studied them for 1 year, I said, look at this, this is what you want. So I said, I will teach you how to work in this place. So, of course, I started working. By that 9 a.m., when they are working, and they say they want to go and drink tea, I just tell them that, at this time, we don't drink tea like this in Nigeria. That I'm working. By around 11 or 12, they say they want to go and take. I said, we don't take now by 11 o'clock in Nigeria. I said, I'm not going. I don't say that to let them go. By 3 o'clock or whatever, I say I'm still working. Weekend, they will tell you that there is an excursion, there is a place to go and watch movie. I tell them I'm not going to excursion. They're coming to UK is an excursion for me. Traveling to UK is a non excursion. I don't need this. I don't think they carry your wallet. So they go, when they close by 5, they now leave me alone in a big lab, big facilities with all the things. I say, wow. Me alone, what 10 of us are struggling to use the load, 10 to 5. Me alone, after they left by 5, I set up parallel experiments. I will walk 5, 6, 7, 8, 9, 10, 11, 12 o'clock. I walk down 5 minutes, edge lane, Liverpool, not far from where Daniel and Moka did everything. In England that time, walk down to my room. Before 8 o'clock, they meet me there. Within 3 months of working in that place, one British guy, a PhD student, I can't forget his name, Stewart Busman, he's from Blackpool, northern part of England. He put a big banner at the entrance of the laboratory. What did he say? He said, "Hail Chief Tunde, our leader and inspiration." So when we put that there, our overall boss, the old man, Dr. Choplity, he came. He just saw that. He said, "What is the meaning of this?" He said, "Who put it there?" He was mad. He was annoyed. Of course, why people. The guy just showed up. He said, "Hey, Joy, see, I'm the one." He said, "Why?" He said, "I've watched this man the last 3 months, and that is my opinion and impression of car." He said, "He has motivated me personally, and he's free. He's free to express, the way he feels about it." The Baba don't look at him like, "What did he not see anything. So that is my impression. He said it's personal, and I just want to express it openly for everybody to know within 3 months. I didn't know the white man was looking. The following week, I met several people there. I was the only black in that place, all of them white from about 5 continents. They have been working there. Within 1 week, he just called me. He said, I can see that you are sound and smart. I'm the only one he asked me to be teaching students. Finally, he has students in that university. He asked me to be taking his lecture. He asked me to be supervising the student. All the other people never gave the responsibilities to them. The only black. I was almost shedding tears. I trained in Nigeria, primary school, secondary school, government school, not even go to what's called private school, government school, public school, primary school, secondary school. Secondary school, my day, we did not have teachers. We taught ourselves physics, chemistry, and biology with Nepal and Abo. We taught ourselves. Somebody will read, you will come and explain. The other one will read chemistry. No teacher, we taught ourselves. And because of that hard work, I graduated secondary school with division 1 in distinction. Went to the polytechnic, went to university, had all my degrees in Nigeria. And I came to UK with the white who have all the best training. And I'm the one who is now teaching them. I was almost shaking I wasn't trained first time of that kind of exposure. And the white man recognized that this guy is now better than all the white. There were people from Spain. Gino Rosca was from Romania. There was another guy from Malaysia. There was another guy from United States. The other guy, the couple from Spain, Lourdes and Damascus, they were together, husband and wife. They came to do Novidiasis. You know them, the way we were sitting in the lab that time, the husband sits here, the wife sits here, and there's something that demarcates. So both of them, they are seeing, looking at each other, you know, the wife. So the guy, when you party, the wife will do like this. The boy too also did the same thing. That is what they were doing throughout. So how are they going to concentrate? So the two of them, they would just spend money, they waste their time and thought like that. When I saw that they were doing that, you know what I did? I just I don't want to see anybody. I don't want any distraction. So that I can concentrate on what I came for. I said, you are people, you have everything. Me, I will go back. Continue your whatever. You can imagine that kind of thing. So, eventually I worked on indigenous, I'm talking about like indigenous carotenoid that is in that book, and that is what that is found in red pamphlet. When I now told the man that I wanted to work, he said they have actually worked on everything. They have carrot in the UK, they have everything. He said, but from the books of carotenoid, he said, you are from Nigeria. I said, yes. He said, there is something, a compound in red palm oil, alpha carotene, that they have never worked before. That is that indigenous and I'm talking about. He said, but how do we get red palm oil? And lo and behold, by accident, I took 2 bottles of red palm oil. Wow. For not to experiment, to use for food. They wanted to take it at the Mutalam and the airport. I fought them. I said, personal effect. I said, you see here. I said, doctor says I must be teaching here. I said, I'm not dropping anything here. I said, check everything. You will see cocaine there, not me. So they took that, I carried it. So when he now said, red palm oil, I was the one back then. And I said, I have 2 bottles of red palm. He said, bring it tomorrow. You can use it for the experiment. So I have to sacrifice
your personal effect
for me to eat. And the do experiment. So I decided to sacrifice it. So I brought the red palm oil. He said, yes. We now set up the experiment of extracting and characterizing alpha carotene that is only indigenous red palm oil, which they don't have there, but we have here. You see our government. So, and now that was what I now worked on for 3 months, day and night, and isolated it, purified it. I got the structure with their facilities and everything.
Everything
The man was happy. So I said, I've gotten the compound. He said, you isolated it. He looked at it. He looked at the structure. He said, fantastic. He said, that is good. We now set up experiment to work on it. And look at the fantastic result we got for the first time with it. So I will work during the day on the project we agreed. In the night, I will work on the one I said. So I was working on the 2 projects. And within 9 months, come and see the level of achievement. Come and see the level of achievements and the productivity. I almost sacked the chief technologist. Her name is Dolores. I can't forget. You can see that I'm telling you what happened in 1995. I'm telling you names. Mrs. Dolores. After 2 months, the woman came to me. The woman said that, he said, Dr. Parombi, he said, look, do you want to sack me? Do you want to take my job? I was shocked. I sack you. I'm not your boss. How can I sack you? I'm not offended. He said, you want to sack me? You want to take my job? He said, you will sack me. The woman meant it. And I said, what is it? He said, it's because of the way you walk. He said, you don't walk like this here. He said, the way you walk, you will sack me. I said, how? The woman said, it's because I do everything myself. That because of the way I'm working, the boss will come one day and will say, you are no longer relevant. And she will do something. That most of the things that I do on my own, she's supposed to do them for me. Prepare some of those things for me. Me, I just come and work. I said, man, where I came from, you do everything yourself. Nobody else, you do everything. I said, I'm used to it. I said, I didn't know. He said, no. So as from tomorrow, I should tell her what I will need, that she will prepare them as a scientist, that I will just come and I will need all those things prepared. So that is the way they work, that I should not do what he's supposed to do. For me, it's my work now, and I know what to do, both the technician, what scientist, that is the truth. You are now seeing why Japan, why the Americans, the Britons, they hunt for our products. Despite the education that we see, when the person is properly trained here, when you get to that place, you will find out that they say, because you are used to working in a very bad and harsh environment. You now find yourself where everything is in the same room. Everything is in the same room. You don't need to take people to anywhere. How will you not outperform anybody? So within 6 months, the people will say, wow, this very good. And that is what happens. That is what happens to black people. So our government is a problem. Who don't respect and recognize science? How many indigenous things that we have here and they don't have this? So look for them. So you are saying that which one of the plants are better? Yeah, and fertilizers and herbs. You are right. Those things that is indirectly care is not taking, you are exposed to environmental chemicals. And environmental chemicals, one your brother can also cause infections for you. Again, there is a need for policy. There is a need for the federal government to also train farmers on how to use the herbicides and chemicals, not to use them indiscriminately. They use some of the chemicals to even preserve some of the trees, some of the cattle, which is not good. Which is not good. You say you want to eat that, but they have used some of this to including bees. Sometimes they say somebody uses a sniper to preserve bees, to kill bees in common place. I mean, you understand what I'm saying? And so it's not good enough to do that. What my own idea and advice is that me, what I do in my house, I don't use oil to come all the land. I have to use, so I plant most of these things, and I try to take some of these things myself. But that is those things in my compound. I plant them around and all these fruits, vegetables, and all those things. They go there, they cut and take the bread. That is one of the secrets of longevity of some of our old people who live in the village. All those things are behind the compound. They don't eat what they don't even eat the second-grade soup. Soup that you put in the soup that gives that stay. Our compound, they don't eat. The man is there by afternoon, the wife goes to the compound and get fresh fufu, fresh vegetables and tomato and make small soup that will be consumed immediately. And they consume it, and when they consume that, bush meat, they eat it, which is low in cholesterol. In the evening, the Baba says, bring me fresh palm wine. Original fresh palm wine contains a lot of the vitamin. The Baba drinks it and he lies down. And the say he lives 110 years. Yes. They live 100 years because of what they eat. Because they don't eat all these junks and what to keep with Peter that have even turned to another entirely. They use microwave machine, we need to actually achieve. So I think the emphasis on a dietary lifestyle is important. Let's replace the rules and everything. But very careful of not taking the fertilizer and chemically tested. I think that's it.
No, thank you so much, bro. Let's appreciate Prof. once All right, before we call on the next speaker, I want to quickly do something to just energize our minds. Let's see the people that are